afternoon. I'm Colin Sandler. I am the owner of Medicaid Solutions. I'm a licensed clinical social worker, and I've been working with the aging population basically my whole career, since I started with my first job at 22 years old, working in a nursing home as a social worker. So this is my passion, and my goal is to educate and help people through the process of figuring out how to manage the long-term care needs for their aging loved ones. So I'm going to share my screen in a moment, and I'm going to do a little PowerPoint and explain basically how Medicaid can help offset the cost of long-term care, which is enormously expensive. So let's get to that. Okay, you can see my screen.
Yep.
Okay, so basically we all know that we have seen either our own parents, loved ones, grandparents, neighbors, and friends. We find ourselves in the role of caregiver. And once we do, the questions start coming, which is, how do I keep my loved ones safe? What type of care is available? Big question is always, what does it cost? And many, many more questions. And of course, in making a good decision about anything, you have to be educated. You have to understand what your resources are and what your options are to make a good decision. And that's really the goal of today's presentation. So determining care needs and how to access services are hard enough, but unless you have unlimited financial resources, or you have terrific long-term care insurance, most people wind up turning to Medicaid at some point to cover or offset the cost of long-term care. So that's where Medicaid comes in for a lot of people. Just as a quick side point, Medicare does not pay for long-term care, no matter what. Medicare pays for short-term acute episodes of care. They will pay for some brief care in a nursing home for rehab, some brief care at home, but it is very limited. So unless you really have a long-term care policy that meets your needs, you're going to pay out of pocket, or you're going to have to look towards Medicaid. There are two different types of Medicaid that you can apply for. There is community-based Medicaid, and there is institutional Medicaid. And to be clear, the Medicaid that we're talking about are really for either aging adults or adults who are disabled. Most of those people, aging adults and adults who are disabled, have another form of insurance, usually Medicare and or some sort of supplemental policy, but those don't cover their long-term care needs. So for community Medicaid, that covers long-term home care services as well as assisted living programs in a very small handful of facilities. There's only one in Westchester, there's one in Carmel, there's a couple in the Bronx, a couple in Manhattan. They're far and few between. And most of them require that you share a very small, almost studio apartment with another person, but it does give you that assisted living facility feeling. And those places also have private pay residents, so they're not just Medicaid facilities. Community Medicaid can pay for home health aides, incontinence supplies, medical transportation, and more. You always keep your Medicare as your primary insurance, even if you're in a nursing home. Medicare can never be usurped. It's always the first insurance that's billed. You only go to the other insurances when Medicare doesn't pay, and they don't pay for long-term care. And currently, Medicaid has no look back for transfers of assets for care in home or any community-based home care. And I'm going to explain what a look back means in a moment. Then we have nursing home Medicaid. Nursing home Medicaid covers long-term placement in a nursing home. I've had a stroke or some major event. I'm staying in a nursing home permanently. I'm not planning to return home. And most nursing homes are anywhere from $13,000 to $18,000 a month. So for most people, that's not a sustainable figure for a long-term placement. In some instances, people do apply for nursing home Medicaid to cover an extended placement, but they still plan to return home. So I'm in a nursing home, I had a stroke, I've used all my Medicare days, I have no more insurance coverage, but I'm not ready to come home yet, but I do anticipate returning home. If you're eligible, you can still apply for Medicaid to cover that stay, even if you are going to return home. Nursing home Medicaid has a 5-year look back, which means from the day you say, I can't pay, I need Medicaid coverage, they're going to want to see all your financials for 5 years. So that is ultimately what look back means. They want a detailed review of all your finances for 5 years. Finance belonging to the applicant, finances belonging to the legal spouse of that applicant, or any finances tied to the applicant, even if it's tied to somebody else like an adult child. So it doesn't matter if the applicant's name is on the account or the spouse's name is on the account. You have to provide those records for 5 years. And the banks do help you get those if most people don't say 5 years worth of records. They literally want every page of every statement for 5 years. And they are looking for details on all transactions. In Westchester County, it's $3,000 or over. Everywhere else, it's $2,000 and over. I have no idea why the difference, but technically, any transaction in and out of the account over that limit, and even under, if they see something that they feel is questionable, they can say, show me the canceled checks, show me the deposit slips, show me where the money came from that you deposited, show me where the money went that you took out. And what they are ultimately looking for are gifts, money that was given away. In theory, in a way that was given away in an effort to qualify for Medicaid, but ultimately they consider any kind of transfer to a child or a grandchild or another family member a gift, unless you receive something in return. And what they do when they see gifts is they penalize you for a period of time consistent with the value of the gift, meaning the more money you gave away, the more time Medicaid will refuse to cover you in the facility based on your gift. And I'm going to talk more about that in a few minutes, but that's what a look back period is. So currently, there is no look back for community-based Medicaid. So we can still transfer. You could have $1 million today, put it in a trust, give it to your child, do whatever you want with it, and next month you can file for community-based Medicaid. However, that is changing. So the changes are that as of January 1st, 2022, Medicaid's going to be implementing a 14-month look back, which is going to go to October of 2020. So starting in January, they're going to require for community-based Medicaid records for 14 months. This is moving toward a full 30-month look back for all community Medicaid applications. So after January, each month, they're going to add a month to the look back. So if you apply in February, there'll be a 15-month look back. In March, there'll be a 16-month look back until we get to April of 2023, and we'll be at the full 30 months. If you want to qualify under the old rules, any asset transfers that you're going to make to qualify have to occur before the end of November, and your Medicaid application for community Medicaid has to occur before December 31st in order to qualify under the rules that exist today. Any applications that are filed after January 1st is going to have that look back. If you transferred your assets prior to October of 2020, regardless of these changes, those transfers will not be penalized. So people are hearing, well, there's going to be a 30-month look back. They're not going back past October 1st. That is the hard line in the sand at this point. So people who did some planning because they heard about the changes, but never pulled the trigger on an application can still file later without an issue. There is always the possibility that this is going to change again. It has been pushed back 4 times already because of COVID. They will not be implementing the changes officially until we are out of a state of emergency for COVID in New York State. I'm sorry, in the United States. So as long as the United States remains in a public health emergency, they cannot implement the changes, which is why it went from October to January, January to April, April to July, and now we're into January of 2022 with the changes. So people keep hearing about them and don't understand that they have not yet been implemented. It is my understanding the United States is not going to lift our emergency until the world is out of the emergency state. So who knows if these changes are going to be pushed back, but I always feel like you got to go with what you know now and plan accordingly because we don't know what the future is going to bring. So how do you qualify for Medicaid? Now we know that the rules are changing. We know that there are different rules for nursing home and for home care. How do you qualify for Medicaid? So there are 2 pieces to qualifying. There are asset limits and income limits, and I'm going to address them separately. Asset limits we're going to talk about first. For a single person, You're not allowed to have more than $15,900 in countable assets. For a married couple where both are applying, husband and wife are both applying, the limit is 23,400, meaning that's the countable assets you can have in your name. So what is a countable asset? What do we mean by that? Basically, it's any funds you or your spouse have in any financial institution. And that's any funds that you or your spouse own together, separately, or with somebody else. So if I have money with my daughter and my husband has money with my son, those counts still have to be presented as well, because they will assume that the money belongs to the parent unless we prove otherwise. Things like checking, savings, CDs, investments, stocks and bonds, annuities from which you don't get any income. I always pause on the 529 issue. The 529 is a savings account for college. And a lot of grandparents open 529s when their grandchildren are born because they get a tax benefit and they're saving for college for their grandbabies. However, that account belongs to the person who opened it. So if you are 70 years old and have a 529 account that's not yet being accessed by your 15-year-old grandchild, and you get sick and you need long-term care, that money belongs to you and has to be liquidated. So I really feel like college savings is not something that an aging adult should really do. And maybe consider giving any accounts you might currently have to the parents of the children you're saving for. Properties other than your primary residence are countable. So I have a house in Florida in addition to my house here in New York. I have property upstate in addition to my property here. I have an empty lot that's attached to my house, but it has a separate deed. Those are considered properties other than my primary residence. They are countable as assets unless only if you live alone, your property that you live in counts as well, unless you have a spouse or a family member living there. So people who are staying for home care at home, technically your property doesn't count. And I'll come back to that in a moment. Cash value of life insurance also counts as an asset. This really only applies to to whole life policies, because those are the ones that have cash value. So if I have $100,000 death benefit, but my policy is worth $30,000 in cash if I cash it in, if I'm only allowed to have $15,000, I can never qualify for Medicaid as long as I own that policy. So life insurance policies can be problematic. I have a question here. What about a married couple with one person applying? So typically in that situation, it really depends on the nuances of the application. We can do something called spousal refusal, where then we count the person as single because the spouse says, I'm not contributing. Or if they're a married couple, the total is $23,000 unless we're doing spousal refusal or spousal impoverishment, where the well spouse can keep something more, and that will kind of come out further on in the presentation. So what is not countable? Well, IRAs, 401ks, 403bs, whatever type of retirement account you may have that has a required distribution. So you have some sort of account that requires you to take money. The IRS requires it every year. The principal of those accounts are not counted towards your available assets. The income that those accounts kick off will be counted on the income side of the discussion, but the asset that is held in those accounts do not count. In Westchester County, Putnam, and the city, they use the same life expectancy table as the IRS. So if the IRS says you have a $100,000 IRA, you have to take $10,000 a year. That's what Medicaid is going to count as your income in order to shelter that asset. If you live outside of those counties, so if you live in Rockland or Putnam or anything north or Long Island, they use a different life expectancy table. And that table will push you to take 2 to 3 times out per year more than the IRS requires in an effort to shelter the account. So you don't really have a choice, because either you have to use the money for your care or you have to take more income to shelter what you're trying to protect in the account. But technically they are exempt. You can also take non-income producing annuities and either annuitize them or put them into payout equivalent to the rules of your county with regard to, it would be using the same formula either that the IRS uses or that the county uses in that area for figuring out your distribution. If you do that, they can also protect the annuities. You don't necessarily have to cash it out. Assets owned solely by your spouse, even if you transferred the money to them in an effort to qualify for Medicaid, under spousal refusal, you can still qualify for Medicaid and they won't count your spouse's assets. But I say that with an asterisk. They can come after, they meaning the county that you live in, can come after this well spouse to get them, sue them for support, to make them pay something towards the care. So you really have to go on a case-by-case situation to see whether the spousal refusal is going to be worth the risk that they're going to come after you for potentially some of the money. In most cases, with either nursing home placement for sure or high hour home care cases, the risk is worth the reward, because you do not, I've not seen anybody get hit for the full amount. So you're paying, if they come after you for spousal refusal, you're paying the Medicaid rate, which is always cheaper than the private pay rate. And they're usually asking you for a percentage of the full rate, of the full Medicaid rate. So you're still paying less, even if you don't get away with paying nothing. So spousal refusal is an option. Assets transferred to an adult disabled child are always exempt, but you have to be very careful about the status of that adult disabled child. An adult disabled child who's 50 years old, went out on disability 5 years ago because he hurt his back at work. He's married, he's got a house, an investment account, a pension, Social Security, but he's getting disability. You could give all your assets to that child to shelter them from Medicaid, and there would be no penalty. It wouldn't affect his disability, and it wouldn't affect your ability to qualify for either nursing home or home care Medicaid, despite any lookbacks. However, if you have an adult disabled child that's been disabled their whole lives, they are probably accessing government benefits already, and then it can be problematic. And then you could look into some sort of trust for them, but that gets into the weeds of planning. So just throwing out the idea that you should look into that option if you have an adult disabled child as to what you can do. Your primary residence is not a countable asset if you are getting long-term care at home, or if you're going into a nursing home, if there is a spouse, an adult child caregiver, or a sibling with a legal interest living in the home, or a co-owner of some sort. However, if the Medicaid applicant is the sole owner of the property and you're getting home care and you do no subsequent planning, Medicaid's going to come after that house when you die. They're going to come after your estate to get repaid. So you do really need to do some sort of planning with your property regardless. But technically, it doesn't count. They won't make you sell your house to get services if you're at home. So that's how the assets are viewed. Income is different. And income works differently for home care and nursing home. So income eligibility for nursing home Medicaid. If there is no spouse, 100% of your gross monthly income has to go to the nursing home. That means no more federal and state taxes can be withheld from any of your pensions, retirement accounts, or anything like that. You have to be dispersed 100% of your gross monthly income. The only thing that is exempt are health insurance premiums, which may be withheld from your income. Otherwise, 100% goes to the nursing home, and the applicant is allotted $50 a month as a stipend for personal needs. That's it. No argument, no discussion. It's dicey because $50 a month, it's been that way since I first started working in a nursing home in 1989. So think about it. It's been 32 years. And still $50. They've never raised that figure. So it bought a hell of a lot more 30 years ago than it does now. And it's unfortunate, but they haven't made the change. If there is a spouse, you have two income scenarios. If the spouse's gross monthly income is below $3,200, so let's say I'm going into a nursing home, I get $1,500 a month, my husband gets $1,500 a month. We live on $3,000 a month, and I go into a nursing home. Medicaid will allow my spouse to keep 100% of our combined income because it's under $3,200. If our income is over $3,200, then they will allow the well spouse at home to keep up to $3,200 of the combined income. So if I get $2,000 a month and my husband gets $4,000 a month and he's going into a nursing home, they will let me keep $1,200 of his income to bring me up to 32, but then the rest of his income goes to the nursing home. So that can be really troublesome when the well spouse is the lower wage earner, because they will lose a large percentage of their spouse's income. And I've seen two really tough scenarios. Both times it was the husband who was earning 5, 6, 7 grand a month in income. The wife was earning like 1,000, but they were living and they needed it. They had still a mortgage. I mean, even though they're older, they had a lot of expenses. And now the wife is stuck having to live on $3,200 no matter what. There's no wiggle room. If the well spouse has more income than the spouse going into the nursing home, so I make $5,000 a month, my husband makes $3,000 a month, I can keep my income under spousal refusal, but all of his income's going to the nursing home. So when the reverse is true, when the higher wage earner is home and the lower wage earner is in the nursing home, it is a little advantageous financially because they can refuse that income. There really isn't a lot of wiggle room here. I've had people say they were going to go for fair hearings and argue, but overall it is not a good outcome for most people, unfortunately. So home care is different. So Medicaid eligibility, excuse me, for income under home care. There's no spouse, or if your well spouse is doing spousal refusal and they're considering you single, you would fall under the same rules. You can keep $904 of your gross monthly income plus the cost of any of your out-of-pocket health insurance premiums. So if I make $2,000 a month and I pay $200 a month for my AARP, they're going to let me keep $1,104 instead of $904. Nowhere in this calculation is any of my living expenses. They don't care about anything. The only exceptions are health insurance premiums. Any income over that 904 is considered a spend down or excess income. And basically because Medicaid is a poverty-based program. So they say you have to come down to the poverty level to qualify. So if I have $2,000 a month, they're essentially saying you pay the first $1,000 a month of your medical expenses, and then we'll pick up the rest. That's what a spend down is. But realistically, who can live on $900 in Westchester County or in New York for that matter? So most people use something called a pooled income trust, which is a mechanism to shelter the money that Medicaid is forcing you to give up. And I'm going to talk about that more on the next slide. So there is a way to shelter that income, but ultimately, anybody who's getting any income over 904 plus their out-of-pocket health insurance premiums are going to have a Medicaid spend down. If there are a spouse, again, there's two possible scenarios, very similar to the nursing home situation. There's a spousal impoverishment budget, which says, again, gross income, you can have less, you can have a combo of 32, 59, 50 and still qualify. But that's only if you go into something called managed long-term care. It's a very specific type of home care that budget applies to. Otherwise, you're back to spousal refusal. So the well spouse, regardless of how much income they have, refuses. They get to keep their income. And then we go back up to the top scenario where the ill spouse at home is going to be considered single, and they're going to have the 904 in income, and they're going to be able to utilize a pooled trust to shelter. So from a purely financial standpoint, income issues are less of an issue in the community than they are in the nursing home, because we can use that pooled trust to shelter, and we cannot use a pooled trust to shelter income in a nursing home. That's not an option. So Medicaid pooled trusts, they are used to shelter the income that Medicaid makes you give up. They pay any expenses that you request that they pay, and they pay them directly to the third party, meaning you say to them, here's my Con Edison bill, here is my request that says I want you to pay $50 to Con Ed, then the pooled trust will cut a check to Con Ed for your account. The bills that the pooled trust pay have to be in the name of the person who's in the pooled trust. So if I'm married and I'm on Medicaid, the bill I submit to the pooled trust has to have my name on it. I cannot submit my cable bill if it just has my husband's name on it. They will not pay it. It can have both our names on it, but it must at least have my name on it. And it really works in function like an online checking account. That's the best analogy I can give you. Every month, the trust company, with your permission, of course, reaches into your bank account and pulls out the amount that Medicaid says you have to give up. So you're still getting all of your income directly to your bank account. Your income is going to you, but then Medicaid pooled trust is going to pull out the excess income and bring it over to the pooled trust company. Once they have it, they're going to take a monthly fee, and then the rest of that money is what's available to pay your living expenses. So just like if you're doing online banking, you go on and you say, pay Cablevision $200 and you press send, you're done. You paid your bill. You don't see a check. You don't write the check. You just know it's going to be paid. Trust kind of does the same thing. You know, you tell them, here's my bill, here's my request to make a payment, and then they cut the check to them. So this is just a little budget scenario that shows how Medicaid looks at your income. So they're going to say, okay, this lovely lady gets a gross income of $1,648.50 from Social Security before anything's deducted. And her gross pension is $500, her gross monthly IRA income is $550. So that gives her $2698.50 per month in gross income. Probably not what she's seeing hitting her bank account every month, but that's how Medicaid's going to show her budget. Then they're going to take out your deductions. So she has $148.50 automatically withheld from her Social Security for her Part B Medicare. Pretty much everyone, unless you're super low income, is having some Medicare Part B premium withheld from their check. Then she's paying $300 a month for her supplemental health insurance and $40 a month for her Part D premium. And then she's allowed $904 a month. That's her allowable income. So they take the $2698.50 and they subtract all of these little items in red. And the difference between this number in the dark green and this number in the light green is $1,306. And that is her Medicaid spend down. So that's what's going to be pulled out of her account every month and put into the trust. And then the trust is going to take their monthly fee. And in this particular case, the fee is about $75 a month. So she's going to have about $1,230 in her trust every month and about $1,244 in her checking account, from which she'll pay her supplemental and her prescription plan. And she'll have $904 after she's done with that. And then we submit her living expenses to the trust. So if her rent's $1,300 a month, we're going to ask them to pay $1,230, and she's going to still have to pay them $70 a month out of her own pocket. Or we're going to send them her telephone, her cable, her electric. You can figure out whatever works for you, but that's ultimately how the budgeting works. So how do I transfer assets to qualify for Medicaid for care at home in the community? Yep. Oh, sorry. So, gotcha. So community Medicaid, as I said, currently you can just move money. So there's no problem, but what does that mean, just move the money? So, if you have a small amount of liquid assets, mom has 50 grand in a checking account and you just want to get her Medicaid eligible, if mom and the children agree, you can go to the bank, pull out 40 grand, give it to one of the children to hold, and mom's Medicaid eligible. But if you own property or you have other assets like investments, brokerage accounts, stocks and bonds, life insurance, you might want to consider an irrevocable trust for those assets. An irrevocable trust is the only trust that is a Medicaid protection trust. If you do a revocable trust, so no IR in front of it, that is a great estate planning tool, but it gives you no real benefit or minimal benefit for a Medicaid application. So whichever way you decide to transfer your assets, you have to keep 2 points in mind. If you transfer your assets before November 30th and apply for community-based Medicaid before December 31st, you can still qualify under the old rules without penalty. If you transfer your assets now, but do not apply for Medicaid before the beginning of next year, you're going to get caught in the 30-month look back. And it doesn't matter whether that look back is 1 month or or 30 months, if you did it after October 1st, you're getting caught in the look back. So October 1st of 2020. So I think, people really need to think about whether this makes sense. And if you didn't do it and you can't qualify, you either have to wait 30 months and then apply and pay your own way for 30 months, or depending on what was transferred, we may be able to use some strategies to reduce the time frame. So that's all still kind of being determined because the rules haven't been implemented yet. So the strategies for protecting stuff aren't really fully in place, but I think it will be similar to what we do for people who apply to nursing home Medicaid and have not yet protected any assets. So, and that's going to be on the next screen. So for those people who are healthy and worried about the future, now is the time to start thinking about doing some asset manipulation, because maybe you'll get past the 2.5 years, or the closer you get to the end of the 2.5 years, obviously, the less you're going to spend out of pocket. You do have to remember that if you have a spouse, that this really doesn't apply to you, because you can transfer assets between spouses without penalty ever. There's no penalty for transferring money to your spouse. So a married couple will still be able to do planning after the changes occur without too much issue. So how to protect assets for nursing home care. And this sort of is going to play into how we're going to protect assets for home care once Medicaid changes the rules. So there is something called a gift note strategy. The note piece of this means a promissory note, which is a loan. So there is a gift and a promissory note. That's what we use to protect assets when somebody either goes into a nursing home and did absolutely no planning, or goes into a nursing home, did planning, but they don't get past the 5-year look back. So either one of those two scenarios. So what happens, as I said in the first slide, when you give away money in an effort to qualify for Medicaid, they impose a penalty. And the penalty means they do not pay for a period of time based on the gift. Well, a promissory note or a loan is not a gift because it's going to be paid back. So they do not penalize you for loaning money. So I'm going to use a 50-50 explanation here. But let's say somebody comes to me and says, I've got $500,000 in countable assets and I need a nursing home. And I don't want to lose everything my parents saved for. So I'm going to use 50-50 as a benchmark, but it's not a 50-50 deal. And I'll tell you why. It depends on how much income the applicant has and how much the nursing home costs. So it could be 40-60. It could be, 60-40. It depends on a lot of factors. But let's just use 50-50 to demonstrate. So I have $500,000. I give a gift of $250,000 to my children. The Lower Hudson Valley penalty rate for giving away money under Medicaid is $13,206 per month. So if I gave away $250,000, I would get an 18.94 month penalty, meaning for the next almost 19 months, I cannot qualify for Medicaid. So I have to pay for Medicaid for those 19 months. The other $250,000 is given as a promissory note to one of the children, meaning I give you $250,000, you have to pay me a loan payment every single month. That loan payment is perfectly structured in combination with my income to cover the private pay cost of the nursing home for the 19 months that Medicaid will refuse to pay. So it is a strategy that allows you to save about, on average, 50% of the assets when you have not gotten through the planning process. So I think it's really important to realize that this is sort of a very general explanation, but that is how the process works. You need an elder law attorney to help you determine what's gifted, what's loaned, how all the dollars and cents shake out. I've seen somebody keep 75% of the money because the person in the nursing home had a high income. And the higher your income, the less of a shortfall you have to pay the nursing home, and therefore the more money you can shelter on the gift side of the gift note. It is a great thing. Nursing home staff and financial people are not going to tell you about this. So you really should never rely on the advice of a nursing facility when you realize that you either can't afford to pay or you're concerned about the cost. I mean, if you have millions and millions of dollars, it's not something I'm sure I would be all that worried about, but most people don't. And it's a real financial hardship if you have to pay $15,000 a month and somebody's living in a nursing home for 3 years. It could really wipe out everything, and they should know their rights. So I really feel like that's, anybody walking into the financial office of a nursing home should walk out and talk to somebody outside the facility before they talk to somebody inside the facility. The caveat with the gift note strategy is the Medicaid application has to be filed right away, knowing they're going to deny it with a penalty period. So you have to file, they deny it. They say, we won't pay for the next 18 months. At the end of the 18 months, we'll start paying. If the person dies before the end of the penalty period, then the rest of the loan is forgiven. You really didn't benefit from your Medicaid application per se, but you don't have a crystal ball. So that's why people do this planning, because they don't know. So the last piece is, if you get Medicaid for home care, how do you actually get home care services? There are really the mainstream way that New York State wants you to access Medicaid home care services is through a managed long-term care model. It's basically like an HMO for home care services. New York State Medicaid pays these managed care programs, which are health insurance companies, a flat monthly premium for every member they bring on board. Then it is expected by New York State that managed care company cover their home care, their day care, their incontinence supplies, their medical transportation, all the things that regular insurance really doesn't cover. So these plans assess based on task only. What that means is physical things that the person cannot do themselves that they need help with: dressing, bathing, toileting, housekeeping, hygiene, light housekeeping, laundry, food shopping, meal preparation. All of those things count. No time is really given for supervision or safety. So I can't tell you how many people come to me and say, I had a managed care evaluation. My mother is completely demented. She needs 24-hour care, and they offered her 4 hours a day. Well, that's because mom only has 4 hours of task-based needs per day. The rest of the day is supervision and safety, and they are not required to cover that, so they don't. So typically the hours are pretty limited. The managed care plan does manage or oversee your care, and you have to use their contracted providers to receive your services. But enrollment is relatively quick after your Medicaid approval. So it's a quick way to get some service in place, but it's not easy to get high level care from managed long-term care. Some people are able to get it, but to be fair, to get more than 6 to 8 hours a day is a real struggle. There is another home care program that is very underutilized. It's called the Nursing Home Transition and Diversion Program. It is also a home care program meant to transition people home from a nursing home placement or divert them from having to go into a nursing home. They can cover those task-based needs as well as supervision and safety. So they have the ability to give you much more service than the managed long-term care can, because their metric for determining care is different. Also, how they get paid is different. Managed long-term care gets paid a monthly stipend that is the same for every single person that comes on their program, regardless of the level of care they're receiving. Whereas the nursing home transition program is still fee for service. So they do get paid, for the services they're providing. There is a limited use of live-in home health aides, meaning an aide that sleeps over in this program. They typically are more inclined to do split shift, which I'm not really, which is doubly expensive and not always indicated. I really wish they would streamline this, because it's costing the state more than it needs to give these services to people who could do just as well with somebody sleeping in the house versus 2 aides up all day. They also have limited use of a program called CDPAP, which I'm going to explain in a second. But the real downside of the nursing home transition program is it can take 3 to 4 months to onboard you once you apply. So there's a longer window to get started with this program. With either plan, technically, you can choose to use something called consumer directed Personal Assistance Program, or CDPAP. This is the program where you can hire your own caregivers. People probably see the commercials for Freedom Care all the time, which just happens to be a company. It's not, Freedom Care is not the name of the program. It is Consumer Directed Personal Assistance Program. But anyone can be chosen to be the caregiver. It can be a family member, but not your spouse. Otherwise, it could be a child, grandchild, anybody over 18. It could be Joe Schmo that you found on the corner. It doesn't matter who it is. But the person you choose has to be legal to work in the US, understand that they're going to be on the books for any money that they earn, and they have to register with a payroll source to get paid. Other than that, they're not required to have any training or certification, but they do have to have a physical and a tuberculosis test, but no other training. It's a great option for people who need to share the cost of the care, because maybe Medicaid's only approving 5 hours a day for demented mom, but we need to have somebody 24 hours a day. So we can supplement. You're saving money, but you're not paying. Or for people who have needs that cannot be met by a licensed agency. You can't put meds in the mouth of somebody. You can't do injections for somebody. A home health aide can't do those tasks. A home health aide can't drive you around. So those kinds of tasks, if it's really necessary for somebody, they would do better with their own aide, because they would be able to do more for the patient. It's really considered like an extension of the family. So, so that's really how home care services work. And that is pretty much the presentation. I know it was a lot in a very short period of time, but I wanted to, make sure that I could give you a flavor for what happens. It really is important for people to individually determine what's going on in their world and what their rights and options are. It is really smart for older people in their late 60s, early 70s and beyond, to start planning, even if they're healthy, and not stick their head in the sand, because it could be financially devastating down the line. That's something that we do here. And there's lots of other people out there like me that do this as well. And it doesn't matter to me where you get the help, as long as you get the help and you've done a little research on who is helping you and make sure they know what they're doing, because not everybody is providing, adequate advice. And that's pretty much my presentation. So thank you.